Okay. Hello everyone, we are the group 1 and will now be tackling about worksheet 3 or module 3 which is entitled Musculoskeletal System. So may I call on Miss Adan to further discuss the overview of the skeleton which is entitled Part 1 Bone Markings.
For bone markings, number 1, match the terms in column B with the appropriate description in column A. For number 1, it is a sharp, slender process. Our answer is spine. Number 2, small rounded projection. Our answer is tubercle. And number 3, large rounded projection. Our answer is tuberosity. Spine, tubercle, and tuberosity is a projection that are site of muscle and ligament attachment. Number 4, structure supported on neck. Our answer is head. For number 5, arm-like projection. Our answer is ramus. And number 6, rounded convex projection. Our answer is condyle. Head, ramus, and condyle is a projection that helps to form joints. For number 7, canal-like structure, our answer is meatus. For number 8, round or oval opening through a bone, our answer is foramen. Number 9, shallow depression, our answer is fossa. And for number 10, air-filled cavity, our answer is sinus. Meatus, foramen, fossa, and sinus are a depression or opening of for passage of bloods and nerves. And for number 11, large irregularly shaped projection, our answer is trochanter. A trochanter, which is a projection that are site of muscle and ligament attachment. Number 2, classifications of bones. The four anatomical classifications of bones are long, short, flat, and irregular, which category has the least amount of spongy bone relative to its volume. Our answer is long bones, because long bones are more compact than a spongy bone. Number 3, classify the bones in the following chart into one of the four major categories by checking the appropriate column. Use appropriate references as necessary. Number 1, humerus. Humerus and phalanx are long bones. Parietal skull. A parietal or skull bone is a flat bone. Calcaneus or tarsal bone is a short bone. Rib is a flat bone. And lastly, vertebra is an irregular bone. Next reporter, please.
Okay, thank you, Miss Adan. Now let's move on to the gross anatomy of long bones. So if it says gross anatomy, it tackles about the gross structure of a long bone. So bone has a dense outer layer, which the external layer is called compact bone. The internal layer is called spongy bone or the trabecular bone. So long bone, it is characterized by longer than wide. So it is named for their elongated shape. So as we see on the PPT, the gross anatomy of long bones includes red marrow, epiphyseal line, medullary cavity, spongy bone, articular cartilage, epiphysis or proximal, diaphysis, epiphysis distal, endosteum, compact bone, yellow marrow, periosteum, compact bone, periosteum again, and trabeculae of spongy bone. So here we can see a sixth item numbering of worksheet. So number 1, it is made almost entirely of compact bone. It is the diaphysis. Number 2, it is the site of blood cell formation. So it is the red marrow. Number 3, fibrous membrane that covers the bone. So the part of it is the periosteum. Number 4, the scientific term for bone end. It is epiphysis. Number 5, contains fat in adult bones. So it is the yellow marrow. And growth plate remnant, it is the epiphyseal line. So number 5, what what difference between compact and spongy bone can be seen with the naked eye? So the difference is compact bone appears solid while spongy bone has obvious spaces. So it is observable in its structure. Compact bone is more solid than the spongy bone has obvious spaces, or it is a much more softer than the compact bone. So let's move on to the chemical composition of bone. So what is the function of the organic matrix in bone? So the function of organic matrix in bone, it is to make bone highly resistant to tensile stress. So number 7, name the important organic bone component. So the important organic bone component present in the form of bone collagen, protoclycan, osteocalcin, or a calcium binding protein, osteoconnectin, which is a protein that anchors bone minerals to collagen. So number 8, calcium salts form the bulk of the inorganic material in bone. So what is the function of the calcium salts? So we answered is the function of calcium salt is to provide hardness and strength and resist compression. And lastly, which is responsible for bone structure? So we must encircle the appropriate response. So both contribute, which is the inorganic portion or the bone salts and organic portion.
So, good day everyone. I am Ryan Edward Bagaslao and I will be reporting about the microscopic structure of compact bone. So, question 10 ask for what is the route that takes what is the route that the nutrients takes place through a bone, starting with the periosteum. So in periosteum, together with the endosteum, it supplies blood to the blood vessels. Then, after periosteum, it travels through the perforating canals, which are the empty spaces that allow blood vessels to travel across the bone, linking it to the central canals. Next is the central canals. In here, nutrients then leave the blood vessels of the central canals and diffuse it to the osteocytes through canaliculi. Then, in the canaliculi, these are tiny canals running from central canal to the lacuna. Um, Canaliculi connects all the living cells of the osteum to the nutrient supply. Then after canaliculi is the lacunae. Lacunae are chambers where the osteocytes can be found. And lastly is the osteocyte. So that is the process of how the nutrients travels through a bone. So for number 11, so the first label here is our answer is canaliculi. Canaliculi are layers of bony matrix around the central canal. Next label here is lamellae, or the site of osteocytes. And the third is the lacunae, which are the longitudinal canal carrying blood vessels. And lastly is the central canal, which are mini canals connecting osteocytes of an osteol. So that's all for the microscopic structure of the compact bone.
Thank you, Ryan. Now let's move on to the actual skeleton or the skull. So may I call on Miss Albarracin to further discuss this slide.
So for this part, the skull, number one, the skull is one of the major components of the axial skeleton. Name the other two. The answers to that is vertebral column and thoracic cage or bony thorax. What structures does each of these three components of the axial skeleton protect? Number First of that is the skull protects the brain. The vertebral column serves as the shield of the spinal cord, which passes through holes in the vertebrae and runs underneath the back. Lastly, we have thoracic cage or rib cage. It is the body part that constitutes the thorax or chest. The thoracic cage defends the heart and lungs. Number two, we have defined suture. Sutures are a kind of fibrous joint or synarthrosis found solely in the skull. It is a type of joint between the bones of the skull in which fibrous tissue holds the bones together securely. Number three, with one exception, the skull bones are joined by sutures. Name the exceptions. The answer is joint or joints between the mandible and temporal bones. Number four, what are the four major sutures of the skull, and what bones do they connect? First is the sagittal suture. It is a dense fibrous connective tissue joint between the two parietal bones of the skull. Then next we have the coronal suture. It is oblique in direction and extends between the frontal and the parietal bones. It is a dense fibrous connective tissue joint that separates the two parietal bones from the frontal bone of the skull. So next, we have the squamous suture. It is the cranial suture between the temporal and parietal bones bilaterally. From the pterion, it extends posteriorly, curves inferiorly, and continues as the parieto-temporal suture. Lambdoid suture or lambdoidal suture. It is a dense fibrous connective tissue joint on the posterior aspect of the skull that connects the parietal bones with the occipital bone. Number five, name the 8 bones composing the cranium. First is frontal. The frontal bone is involved in 3 areas of the head, including the forehead, the orbit, and nose. The bone is divided into 2 sections. These are the vertically oriented squamous part and the horizontally oriented orbital part, which together make up the bony part of the forehead, part of the bony orbital cavity holding the eye, and part of the bony part of the nose. Next, we have the sphenoid. The sphenoid bone is considered to be the most intricate bone in the human body. It is also known as the wasp bone due to its shape. It occupies the majority of the middle part of the base of the skull and makes a significant contribution to the floor of the middle cranial fossa. Next, we have the occipital. It is a cranial dermal bone and the occiput's main bone, back and lower part of the skull. It has a trapezoidal shape and is curved inward like a shallow dish. The occipital bone sits on top of the cerebrum's occipital lobes. Next, we have the ethmoid. It is a single bone in the skull that connects the nasal cavity to the brain. It is located between the 2 orbits on the roof of the nose. Because of its spongy construction, the cubical bone is lightweight. Then, 5 to 6, we have the right and left parietal. It is found on both sides of the skull, just behind the frontal bone. The majority of the cranial roof and sides of the skull are formed by both parietal bones. Each parietal bone has 4 angles, 4 margins, and 2 surfaces, and has an irregular quadrilateral shape. 7 to 8, we have right and left temporal. They contribute to the formation of the sides and base of the skull, which protects the temporal lobe of the brain and surrounds the ear canal rather. Number 6, give 2 possible functions of the sinuses. So first is it improve our voice. Then next is it lighten the skull and produce mucus to protect the nose. Number 7, what is the orbit? So the orbit is the hollow or socket in the skull that houses the eye and its appendages, which protects, maintains, and optimizes the eye's function. Lastly, we have why can the sphenoid bone be called the keystone of the cranial floor? The answer is it is known as the keystone of the cranial floor because it connects with all of the other cranial bones. So for this part, we have the bones of the pectoral girdle and upper limb.
So may I call on Miss Bautista to further discuss this topic?
We're gonna discuss about the actual skeleton. First is bone forming anterior cranium or forehead. Our answer for keyword frontal. Second, the cheekbone. It is zygomatic. Third, upper jaw. The keyword is maxilla. Fourth, bridge of the nose. The keyword is nasal. Fifth, posterior roof of the mouth. Our keyword is palatine. Sixth, bone pair united by the sagittal suture. It is the parietal. Number 7, site of jugular foramen and carotid canal. It is the temporal. Number 8, contains a saddle that houses the pituitary gland. Our keyword is sphenoid. Number 9, has an opening that allows tears to pass. It is the lacrimal. Number 10, forms most of hard palate. The keyword is palatine. Number 11, superior and medial nasal conchae are part of this bone. It is the ethmoid. Number 12, site of external auditory meatus. It is the temporal. Number 13, has greater and lesser wings. It is identified as the sphenoid. Number 14, its holly and plate allows olfactory fibers to pass. Our keyword is ethnoid. 15. Facial bone that contains a sinus. It is part of the maxilla. Number 16. Three cranial bones containing paranasal sinuses. It is the frontal, maxillary, and ethnoid. Number 17. Its oval-shaped protrusions articulate with the atlas. It is the occipital. Number 18. Spinal cord passes through a large opening in this bone. Our keyword is occipital. Number 19. Not really a skull bone, which is a sphenoid. Number 20. Forms the chin. Our keyword is mandible. Number 21. Inferior part of nasal septum, which is the maxillary. Contain alveoli bearing teeth. It is the mandible and maxilla. 23. Bears up upward protrusion called the rooster's comb, which is the ethmoid. Next is the actual skeletal or the skull identification. At the top part of the skull, we have the sagittal suture and coronal suture. Next is the frontal lobe, which located in the forehead. Parietal bone is in the side of the skull, and sphenoid bone, which is located in the eye sac or in inside the opening of the skull in our eyesights. The temporal is in our side, which is located in our forehead in the side, and ethmoid, which is pin in our eye sac, and lacrimal, which is lower, which is on the part of our eye bag inside of the bone. Zygomatic bone is in the cheeks, and maxilla, which is located in our upper of our teeth. And alveolar process of maxilla is below and maxilla. We in the down layer of the skull, we can see the mandible. Next is the vomer, which is in the center part of the bone in our nasal, and inferior nasal concha is inside in the right side of the vomer, and middle nasal concha of ethmoid is in the upper part of the nasal. And the nasal bone is, you can see at the upper part of the nasal bridge. That's all.
So thank you, Miss Bautista. So I am Crystal Clear Agustin, and I will be discussing now about the fetal skull. So number 11. So are the same skull bones seen in the adult also found in the fetal skull? So our answer is no. It is because some areas of the fetal skull still remain to be converted to bone. So it hasn't fused yet or not yet undergoes the completion of bone ossification. So unlike the adult bone, it is much more complete than the fetal skull. So if we say fetal skull, it is the head of a fetus or an infant. So number 12, how does the size of the fetal face compares to its cranium? So at birth and in infancy, the fetal face is much smaller to its cranium, which is huge relative. It is overshadowed by the large cranium. So why it is much smaller? It is because during the um, birth, passage of pregnancy, smaller head or softer skull of the infant capable of that is to undergo smooth delivery during birth. So how does this compare to the adult skull? So adult skull is 1/8 total body length, whereas the fetal skull is 1/4 total body length. So in the adult, the cranium is proportionally smaller and the facial bones are proportionally larger and more prominent. So fetal skull is relatively much smaller than the adult skull. So number 13, what are the outward conical projections on some of the fetal cranial bones? So these are the growth ossification centers or the spaces between the bones on the fetal skull. So what is a fontanelle? So a fontanelle is a fibrous membrane between the bones of the fetal skull. So these fibrous membranes connecting the cranial bones, allowing the fetal skull to be compressed slightly during birth and also allow for brain growth in the fetus and infant. So what is its fate or fontanelle? So its fate is that these areas become bony or ossify as the infant ages. So completing the process by the age of 20 to 22 months. So it will become bone by the end of 22 months, which is now be progressively ossified and replaced by a suture. So it will now undergo completion of bone ossification. So lastly, what is the function of the fontanelles in the fetal skull? So fontanelles allow skull to be compressed during birth and also allows for brain growth during late fetal life. So as we can see in the diagram, this is the fetal skull in which the upper portion is the anterior fontanelle, side the sphenoid fontanelle, front is the frontal bone, other side temporal bone, mastoid fontanelle, occipital bone, posterior fontanelle on the back, and the parietal bone. So next, we have now the vertebral column. So may I call on Mr. Bernadas to further discuss this topic.
Good morning, ma'am, sir. This is my part. So for the vertebral column, number one, we have cavity enclosing the nerve cord, and our answer is letter I, which is vertebral foramen. Next, we have weight-bearing portion of the vertebra, and our answer is A, which is body. Number three, provide levers against which muscles pull, and the answer is E and G, which is spinous process and transverse process. Number four, we have provide an articulation point for the ribs. And our answer is A and G. We have A and G, which is body and transverse process. Next, number five, we have opening providing for exit of spinal nerves. And our answer is letter B, which is intervertebral foramina. Next, number six, structures that form an enclosure for the spinal cord. And our answer is letter A and H, which is body and vertebral arc. Next, for number 17, part 17, we have number one, vertebral type with a bifid or forked spinous process. We have cervical vertebra typical. Next, we have number 2, pivots on C squared, lacks a body. We have axis. Next, number 3, beer facets for articulations with ribs form part of bony thoracic cage, and we have thoracic vertebra. Next, number 4, we have forms a joint with the hip bone, and our answer is sacrum. Next, number 5, vertebra with block-like body and short, stout spinous process, and we have lumbar vertebra. Next, number 6, this is what we call tailbone, and our answer is coccyx. Number 7, we have articulates with the occipital condyles, and we have atlas. Number 8, 5 components and unfused, which is lumbar curvature. Next, number 9, 12 components and unfused, which is thoracic vertebra. Lastly, number 10, 5 components fused, which is sacrum.
So may I call on Mr. Ryan Bagaslao to further discuss the vertebral column.
Thank you, Miss Crystal. So for the continuation for the vertebral column, so for number 18, um, this is the thoracic vertebrae in a lateral view. So the first picture, as you can see, and the label that has this two that points out the which points out the superior and inferior costal facet for rib. And the other red labels are called the markings that I was asked to identify and label. And there we can see the transverse process at the top top left corner, and just below is the spinous process, and then we can also see the superior articular process, and as well as the body on the right side. So for the second picture, that is the cervical vertebrae in superior view. So the first one that points out to the center, the empty center, that is called the vertebral foramen. And next one, below below that one is the another part of the vertebra, which is called lamina. And the same with earlier, there is also transverse classes that we can see. We can also see the body and the superior articular process as well as the spinous process. So for question number 19, what kind of tissue makes up the intervertebral disc? So it is the vertebral disc is composed of fibrocartilage, which is the tissue making up the vertebral disc. So what is a herniated disc? A herniated disc, or also known as bulging disc, is an injury in the spine. It occurs when some of the nucleus pushes out through a tear and causes the annulus to tear, and which is one of the most common causes of neck, back, and leg pain. Oftentimes, a herniated disc may occur due to injury, sudden strain from improper lifting or twisting, repetitive motions, as well as genetics and any traumatic event such as fall or a blow to the back which damages our spine. So next slide, please. So as you can see, this is the our vertebral column. So our vertebral column is composed of 24, 24 vertebrae, single vertebrae, and two fused bones, which is called the sacrum and the co- coccyx. So the first seven is called the cervical vertebrae, and as you can see at the topmost allocation, the C1 is called or also called as atlas, and just below the cervic first cervical vertebrae is the cervical vertebrae, which is called the axis. Then after that, there is 12 thoracic vertebrae. So it's in here it is not specified, so for sure this is the called thoracic vertebrae. And then after that is the intervertebral disc, and which is um that connects the bones. Here, as you can see, it is located in the somewhere in the middle, and the same goes as along them. Then there's also called the two lumbar vertebrae, and lastly is the one of the fused bone, which is the sacrum. And that's all.
So let's now move on to the bony thorax. So may I call on Miss Adan to further discuss this topic.
For number 22, the major components of the bony thorax, excluding the vertebral column, are the ribs with their associated cartilages and the sternum. Number 3, what is the general shape of the thoracic cage? It forms a semi-rigid chamber which can increase and decrease in volume during respiration. Number 24, the landmarks of the bony thorax. First is the costal cartilage. Next is the true ribs, false ribs, the floating ribs, and the parts of the sternum which are the manubrium, body, and xiphoid process. Number 25. Differentiate a true rib from a false rib. True ribs or superior seven ribs articulate with thoracic vertebrae attached directly through costal cartilages to the sternum. False ribs is divided into two. First is first the eighth, ninth, and tenth ribs the are the vertebrocondyle ribs are joined by common cartilage to the costal cartilage of the seventh rib, which is attached to the sternum. Second, two of the false ribs, the 11th and 12th, are also called floating ribs or vertebral ribs because they do not attach to the sternum. Number 26. What is a floating rib? A floating rib is a false ribs which is composed of the 11th and 12th ribs that is not attached to the sternum. A floating rib is also called as vertebral ribs.
Thank you, Miss Adan. Now let's move on to the part 3, which is the appendicular skeleton, which is entitled Part 1, Bones of the Pectoral Girdle and Upper Limb. So may I call on Miss Albarracin to further discuss this topic.
Pectoral girdle and upper limb. So for the arm side, we have first the acromion. It is the bony tip of your shoulder blade's outer edge or scapula that protrudes from the top of the back side of this bone, and at your shoulder, it connects with the end of your collar bone or clavicle. Next, we have the greater tubercle. It is the crucial component of bone at the top of the humerus, where the two large, powerful rotator cuff So for this part, we have the bones of the pectoral girdle and upper limb. So for the arm side, we have first the acromion. It is the bony tip of your shoulder blade's outer edge or scapula that protrudes from the top of the back side of this bone. And at your shoulder, it connects with the end of your collarbone or clavicle. Next, we have the greater tubercle. It is the crucial component of bone at the top of the humerus, where the two large, powerful rotator cuff muscles, supraspinatus and infraspinatus, attach. Next, we have the subscapular fossa. It is a wide concavity on the scapula's costal surface. It is located on the deep side of the scapula, as the name suggests. Next, we have deltoid tuberosity. It is a rough, triangular area on the anterolateral or front surface of the humerus middle. Tendons connect the deltoid to the skeleton at the clavicle and the scapula and humerus. Lateral epicondyle, the bony bump on the lateral side or outside of the elbow. Capitulum, the capitulum or small head is the lateral part of the humeral condyle that communicates well with forearm radius bone. Radius, it is one of the two bones that comprises the forearm rather. It is responsible for forming the radiocarpal joint at the wrist, and it is a smaller version of ulna. Styloid process. Styloid process. It is a bony prominence located in the forearm at the distal end of the ulna. It is essential for the strength and flexibility of your wrist and forearm. For the rib part, we have the coracoid process. It is a thick curved process located on the upper part of the scapula's neck by a broad base. Clavicle, we have the clavicle. It is also known as the collarbone. It's the only bone that connects the pectoral girdle to the axial skeleton and is the only long bone in the human skeleton that rests horizontally. Scapula. It is a large triangular shaped bone in the upper back. Humerus, it is the largest bone of the upper extremity and it defines the human brachium arm. Coronoid fossa. When the elbow joint is flexed, the coronoid fossa is a depression on the crania surface indicates medial to radial fossa that accommodates the medial coronoid process of the ulna. Medial epicondyle is an epicondyle of the humerus bone of the upper arm. It is larger and more notable than the lateral epicondyle, and its anatomical position directs it slightly more posteriorly. Trochlea. It is the medial portion of the elbow joint's articular surface that communicates with the trochlear notch on the ulna in the forearm. Coronoid process. It is a triangular eminence that projects forward from the ulna's upper and front parts. Radial tuberosity can be found on the medial side beneath the radius neck. It is an anterior, smooth portion with a bursa position between the tendon and the bone. Ulna. It articulates with the radius both proximally and distally and forms the elbow joint with the humerus. It is larger than the radius. Styloid process. I've already explained this earlier, so let's now proceed to carpals. So carpals, the 8 oddly shaped carpals are the hand's most proximal bones. Then metacarpals, 5 long bones between the carpal bones and the proximal phalanges of the hand. Lastly, the phalanges are the tubular bones that make up the fingers and thumb. It is starting at the thumb and moving lateral to medial.
So, for the continuation of the appendicular skeleton, may I call on Miss Asumbrado to further discuss this topic?
Next is match the bone names or markings in column B with the descriptions in column A. Number 1. Raised area on lateral surface of humerus to which deltoid muscle attaches. The answer is deltoid tuberosity. Number 2. Arm bone. The answer is humerus. Number 3. Bones of the shoulder girdle. The answer is clavicle and scapula. Number 4. Forearm bones. The answer is radius and ulna. Number 5. Scapular region to which the clavicle connects. The answer is acromion. Number 6. Shoulder girdle bone that is unattached to the axial skeleton. The answer is scapula. Number 7. Shoulder girdle bone that articulates with and transmit forces to the bony thorax. The answer is clavicle. Number 8. Depression in the scapula that articulates with the humerus. The answer is glenoid cavity. Number 9. Process above the glenoid cavity that permits muscle attachment. The answer is coracoid process. Next is number 10, the collarbone. The answer is clavicle. 11. Distal condyle of the humerus that articulates with the ulna. The answer is trochlea. 12. Medial bone of forearm in anatomical position. The answer is ulna. 13. Rounded knob on the humerus articulates with the radius. The answer is capitulum. 14. Anterior depression superior to trochlea that receive part of the ulna when the forearm is flexed. The answer is coronoid fossa. 15. Forearm bone involve inflammation of the elbow joint. The answer is ulna. 16. Wrist bones. The answer is carpals. Next, 17. Finger bone. The answer is phalanges. 18. Heads of these bones from the knuckle. The answer is metacarpals. Lastly, number 19. Bones that articulate with the clavicle. The answer is scapula and sternum.
So for the continuation of the appendicular skeleton, so number 3, why is the clavicle at risk to fracture when a person falls on his or her shoulder? So it is because it is a slender and lightweight bone and it is easy to break or fracture. So number 4, the scapula has no direct attachment to the axial skeleton. So how does this affect the movement of the shoulder? So it moves freely across the posterior surface of the thorax. Number 5, what is the total number of phalanges in the hand? It is 14. And lastly, number 6, what is the total number of carpals in the wrist? Now it is 8. Now for the bones of the pelvic girdle and lower limb, may I call on Mr. Ryan Edward Bagaslao to further discuss the topic.
Okay, so for the continuation, compare the pectoral and pelvic girdles. So in terms of flexibility, pectoral girdle is more flexible than pelvic girdle. However, security-wise, pelvic girdle is heavier and more secured to axial skeleton compared to the pectoral girdle. As well as, in terms of weight-bearing ability, pelvic girdle is much better at weight bearing. Next question is, what organs are protected at least in part by the pelvic girdle? So the organs that are protected by the pelvic girdle are uterus, bladder, rectum, small intestine, and the reproductive organs. For number 9, distinguish the true pelvis from the false pelvis. So the true pelvis is the inferior region that is almost entirely surrounded by bone, and its posterior boundary is the sacrum, while the false pelvis is the superior portion bounded by the ilia laterally and the sacrum and lumbar vertebrae posteriorly. So for, for the number for the next item, as you can see in the picture, this is the bone of the coxal. So and parts of the coxal bone, the red labels are ilium, pubis, and ischium. So those are the bones. And the other ones are the iliac crest, anterior superior iliac spine, acetabulum, obturator foramen, ischial tuberosity, ischial spine, and at greater sciatic notch. So for number 11, the pelvic bones of a four-legged animal such as a cat or a pig are much less massive than those of the human. Why is this so? So I think that this is because when we observe a four-legged animal such as a cat or a pig, we can see or we can observe that the weight of their body is evenly distributed to their four legs, which means that it doesn't necessarily require massive pelvic bones, unlike those of the humans that only has two legs whose weight of their upper body solely relies on its pelvic bones. So that is why it is much more massive and in order to withstand the body weight. And for the last number, a person instinctively curls over the abdominal area in times of danger. Why? So, the reason why a person instinctively curls over in times of danger is in order to protect their abdominal area. Since, di ba, the abdominal area is not protected by the bones when uh and is not covered by the bones, which protects the body's internal organs. Thank you very much.
Thank you, Mr. Ryan. So let's move on now to the continuation of the bones of the pelvic girdle and lower limb. So may I call on Mr. Bernadas to further tackle this topic.
So for the parts of femur, first we have the circular part, which is the head of femur, and below it we have the neck of femur, which connects to the greater trochanter, and under we have lesser trochanter, and between them we have intertrochanteric crest, and below that we have gluteal tuberosity. For the left side below, we have medial condyle, and for the middle part, we have intercondylar fossa, and for the last part, we have lateral condyle. The femur shown above is the right member of the two femurs. Next, for the lower limb, we have sacroiliac joint, sacroiliac joint, and for number one, we have ilium. Under it, we have acetabulum rim. Next, we have neck of femur. And next, we have pubic symphysis. Below the neck femur, we have greater trochanter. And below the pubic symphysis, we have pubis, ischium, and lesser trochanter. Now we have femur. And below it, we have lateral condyle. On the middle part, we have patella. Below, we have medial condyle and tibial tuberosity. Now we have fibula for number 6. Number 7, we have tibia. Below it, we have medial malleolus. And for number 9, number 8, we have talus. Above it, we have lateral malleolus. And for number 9, we have calcaneus tarsals. Number 10, we have metatarsals. And for 11, we have phalanges.
Now for the continuation. So number one, it is the fuse to form the coxal bone. So it has three answers, which is the ilium, ischium, and pubis. Number 2, it is the sit-down bone of the coxal bone. The answer is ischium. And number 3, it is the point where the coxal bones join anteriorly. So the answer is pubic symphysis. Number 4, superior most margin of the coxal bone. So the answer is iliac crest. And number 5, deep socket in the coxal bone that receives the head of the thigh bone. So the answer is acetabulum. Then number 6, it is joint between axial skeleton and pelvic girdle. And the answer is sacroiliac joint. And number 7, the longest or strongest bone in the body. So the answer is femur. And number 8, it is thin lateral leg bone. And the answer is fibula. And number 9, heavy medial leg bone. And the answer is tibia. And number 10, bones forming knee joint. So the answer is femur and tibia. And number 11, it is the point where the patellar ligament attaches. And the answer is tibial tuberosity. And number 12, it is the kneecap. So the answer is the patella. And number 13, the shin bone, it is the tibia. And number 14, medial ankle projection. It is the medial malleolus. And number 15, lateral ankle projection. It is the lateral malleolus. So 16, it is the two largest tarsal bones. It is the calcaneus and the talus. And 17, ankle bone, which is the tarsals. 18, bones forming the instep of the foot. The answer is metatarsals. 19, opening in hip bone formed by the pubic and ischial rami. So the answer is obturator foramen. And number 20, it is the sites of muscle attachment on the proximal femur. The answer is gluteal tuberosity and greater and lesser trochanters. Number 21, tarsal bone that sits on the calcaneus. So the answer is talus. And number 22, weight-bearing bone of the leg. It is the tibia. And lastly, tarsal bone that articulates with the tibia. And the answer is talus. So let's move on now to the types of joints. So joints and body movements. So use the key terms to identify the joint types described below. So number 1, it is typically allow a slight degree of movement. So it is the cartilaginous joint. So number 2, so it includes joints between the vertebral bodies and the pubic symphysis. Again, it is the cartilaginous. Number 3, essentially immovable joints. It is now the fibrous. And sutures are the most remembered examples. So these are the fibrous joints. And number 5, cartilage connects the bony portions. It is the cartilaginous joint. Number 6, have a fibrous articular capsule lined with a synovial membrane surrounding a joint cavity. It is the synovial. Number 7, all are freely movable or diathrotic. It is the synovial again. And number 8, bone regions are united by fibrous connective tissue. It is the fibrous joint. And lastly, number 9, it includes the hip, knee, and elbow joints. And it is the synovial joint. So may I call on Miss Bautista to further discuss the continuation of joints and body movements, which is the type of joints part 2.
We have number 1. We have joint between most skull's bones. It is the suture. Number 2. Joint between the axis and atlas. It is the pivot. And number 3. The hip joint, which is the ball and socket. Number 4. Joint between forearm bones and wrist. It is also known as condylar. Number 5. The elbow, which is the hinge. Number 6. Interphalangeal interphalangeal joints, which is the synovial. Number 7, intercarpal joints. It is the plane joint. 8, joint between the skull and vertebral column, which is also known as condylar. Number 9, joints between proximal phalanges and metacarpal bones, which is synovial. And lastly, multi-axial joint. which is the ball and socket. Choices that is type of synovial joint. It is considered as pivot, hinge, saddle joint, ball and socket joint, and condylar and plane joint. Number 3. What characteristics do all joints have in common? Joints, also called articulations, where two or more bones are meet. In other words, two functions they hold the bones together securely and give mobility, classified in two ways, which is functional and structurally. Number 4, we have the ligament, which is be found in the upper layer of the joint, and the below the ligament we have synovial. And as you can see, there's a part there in the center. It is called the joint cavity, which is leading in the center of the joint. Second is the articular cartilage, which is the inside. It is pointing at the layer below the in that area. Next is the bursa. It is pointing in the side of the joint. And third is synovial membrane, which is pointing most furthermore in bursa, which is in located. Ligament. It is a skeletal ligaments or discrete bands of dense fibrous connective tissue that connect bones, mechanically controlling and stabilizing the articulation of joints to distribute force and to protect other articular tissues. Articular cartilage. Its principal function is to provide a smooth, lubricated surface or low friction articulation and to facilitate the transmission of loads to the underlying subchondral bone. Third, synovial membrane. The synovial membrane, or synovium, is the connective tissue which lines the inner surface of the capsule of the synovial joint and secretes synovial fluid, which serves a lubricating function, allowing joint surfaces to smoothly move across each other. Lastly is the bursa. The bursa acts as a cushion between muscles, ligaments, and bones, and allows structure to glide and slide past one another with ease and with minimal friction. Injury to a bursa may cause pain, limited motion, and decreased functional mobility. Lastly, the acetabulum of the pelvis fully encompasses the femoral head, and this makes the hip joint far more stable. Two important factors that contribute to the stability of the hip are more acetabular labrum and the ligamentum teres. That's all. Thank you.
Now let's move on to the movements allowed by synovial joints. So may I call on Mr. Bernadas to further discuss this topic.
Thank you. Now for the movements allowed by synovial joints, we have number 6. During muscle contraction, the insertion moves toward the origin. And for number 7, we have complete the description below the diagram by inserting the type of movement in each answer na blank. So letter A, we have extension at the elbow. B for flexion at the knee. C, adduction. C, adduction of the upper limb. D for abduction of the lower limb. E, E for circumduction of the upper limb. We have letter F for inversion of the foot. G, rotation of the head. And lastly, H, pronation of the forearm. That's all for the movements allowed by synovial joints.
For the muscles,
Mo pagyapon, Kirk.
Kailan nawala na. For joint disorders, we have number 8. What structural changes are common in older people? Degenerative changes, adhesions, and bone spurs begin to sprout up in diarthrotic, diarthrotic joints. Intervertebral discs begin to degenerate. These changes leads to increased joint stiffness and pain. And we have number 9, define dislocation. A dislocation is an injury to a joint, a place where two or more bones come together, in which the ends of your bones are forced than their normal position. This painful injury temporarily deforms and immobilize your joint. Dislocation is most common in shoulders and fingers.
So for the next slide, it is the part 5, which is the gross anatomy of the muscular system. Part 1, it is the muscles of the head and neck. So may I call on Miss Albarracin to further discuss the topic.
So for the muscles of the head and neck, we have here number 1, we have the virtual depiction of our muscles of the head and neck. Then on the other hand, we have number 2, it is composed of their basic functions. So now, I decided to link both 1 and 2 to save time and make it shorter. So as you can see, the zygomaticus muscle is used for grinning. The orbicularis oris muscle is used during whistling, blinking, squinting, and kissing. Then the orbicularis oculi muscle closes the eyelids and aids in the transport of tears from the eye to the nasolacrimal duct system. The platysma muscle makes the sad clown face because it pulls the corners of the mouth rather downward, and it also tenses the skin after shaving. The frontalis muscle is used when you are raising your eyebrows for a questioning expression. Then the masseter muscle aids you to bite something. Lastly, we have the buccinator muscles. It aids us rather in chewing foods.
Now for the muscles of the trunk and upper limb, may I call on Miss Bautista to tackle this topic.
For the muscle of the trunk and upper limb, number 1, we have a major spine flexor. The keyword is erector. Second, prime mover or pulling the arm posteriorly is the latissimus dorsi. Third, elbow extender, which is also known as triceps brachii. Number 4, help from abdominal girdle. 4 pairs of muscles. These are the rectus abdominis, external oblique, internal oblique, and transverse abdominis. Fifth, extends and abducts the wrist. It is the deltoid. Number 7, shoulder abductors. The two muscles are the deltoid and suprapinatus. Number 8, flexus elbow supinates the forearm, which is the keyword is biceps brachii. Number 9, small muscles between the ribs are intercostals. Number 10, extends the head. It is the sternocleidomastoid. Number 11, extends the spine, which is the erector spinae. Number 12, extends the abducts the wrist is the extensor corpi radialis. That's all. Thank you.
Now for the muscles of the lower limb. So number 1, it is the lateral compartment muscle that plantar flexes and everts the ankle. So the answer is the fibularis peroneus muscles. So number 2, it forms the buttock, which is the gluteus maximus. And number 3, a prime mover of ankle plantar flexion. It is the gastrocnemius. And number 4, a prime mover of ankle dorsiflexion. It is the tibialis anterior. And number 5, allows you to grip a horse back with your thighs. It is the adductor group. And 6, muscles that insert into the tibial tuberosity. It is the rectus femoris and vastus muscles. And number 7, muscles that extend thigh and flex knee. It is biceps femoris, semitendinosus, and semimembranosus. And number 8, prime mover of inversion of the foot. It is the tibialis anterior. Number 9, prime mover of dorsiflexion of the foot. It is the tibialis anterior again. Number 10, adduct the thigh as when standing at attention. It is the adductor group. And number 11, it extends the toes. So its answer is the extensor digitorum longus. Number 12, extends knee and flexes thigh. It is the rectus femoris. 13, used to extend the hip when climbing stairs. It is the gluteus maximus. And lastly, prime movers of plantar flexion or two muscles of the foot, which is the gastrocnemius. So, in the general review muscle descriptions, so may I call on Miss Adan to further discuss this topic. Ay, ako po di, ay, shit. Balik. What ba di, ay? So, for the general review muscle descriptions, so number 1, complete the following statements. Use your textbook as necessary. So, number 1, so the three that are commonly used for intramuscular injections. There are three muscles, which is the deltoid, vastus lateralis, and gluteus medius. And number 2, the insertion tendon of the blank group contains a large sysboid bone or the patella. The answer is the quadriceps. Number 3, the gastrocnemius and soleus muscles insert in common into the black tendon. So the answer is calcaneal. Number 4, the bulk of the tissue of a muscle tends to lie blank to the part of the body it causes to move. The answer is proximal. And number 5, the extrinsic muscles originate on the blank. It is the forearm. And lastly, it is the most flexor muscles are located on the blank aspect of the body. So most extensors are located blank. An exception to this generalization is the extensor flexor musculature of the blank. So the answer of the three blanks is the inferior, posterior, and knee. So for the general review, muscle recognitions. So may I call on Miss Adan to further tackle this topic.
For number 6, identify the lettered muscle in the diagram of the human anterior superficial musculature by matching each letter with one of the following muscle names. For number 1, orbicularis oris, letter T. Number 2, pectoralis major, letter V. External oblique, letter Z. Sternocleidomastoid, letter U. Number 5, biceps brachii, letter G. Number 6, deltoid, letter E. Number 7, vastus lateralis, letter L. Frontalis, letter Q. Number 9, rectus femoris, K. Rectus abdominus, number 10, letter W. Number 11, sartorius, AA. Number 12, platysma, letter C. Flexor carpi radialis, letter I. Number 14, orbicularis oculi, R. Number 15, gastrocnemius, CC. 16, masseter, letter B. 17, trapezius, letter D. Number 9, number 18, tibialis anterior, letter P. Number 19, abductors, BB. Number 20, letter M, vastus medialis. Number 21, transversus abdominis, letter X. Fib- Fibularis longus, letter N. Letter number 23, letter J, iliopsoas. 24, temporalis, letter A. 25, zygomaticus, letter S. Number 26, triceps brachii, letter F. Number 27, brachialis, letter H. Number 28, extensor digitorum longus, letter O. Number 29, internal oblique, letter Y. Number 30, soleus DD.
And now last but not the least, so we have the continuation of the general review muscle recognition. So may I call on Miss Asumbrado to further tackle this topic.
Next is general review. Muscle recognition. Identify each of the latter muscle in this diagram of the human posterior superficial musculature by matching the letter to one of the following muscle names. Number 1, gluteus maximus, letter N. 2, semimembranosus, letter R. 3, gastrocnemius, letter F. 4, latissimus dorsi, letter K. 5, deltoid, letter J. 6, semitendinosus, letter Q. 7, trapezius, I. 8, bicep femoris, letter P. 9, tricep bronchi, A. 10, external oblique, letter L. 11, gluteus medius, letter M. 12, flexor carpi ulnaris, letter C. 13, extensor carpi ulnaris, letter D. 14, extensor digitorum, letter E. 15, extensor carpi radialis, letter B. 16, sternocleidomastoid, letter H. 17, adductor magnus, letter O. And lastly, soleus, letter G. That's all. Thank you.